Hello and thank you for taking the time to watch this 2019 Benefits Open Enrollment webinar. We encourage you to carefully review your options and choose the benefits that are best for you. You will have the opportunity to add or change your benefits between November 1st and November 16th by logging into Workday and completing the open enrollment event found in your Workday inbox. First, we'll discuss your medical and prescription insurance options, which are provided by Aetna and CVS Caremark. For 2019, the university will continue to offer the PPO and PPO savings plans. Both plans have the same network of providers, cover preventive services at 100%, cover prescription medications, and have a 10% coinsurance for in-network services after the deductible is met. There are several differences between the two plans. For the PPO savings plan, it has a lower premium with a higher deductible. Also, the plan has a health savings account included, which we will talk more about later. For the PPO plan, you are subject to a copay when you visit your primary care physician, a specialist, or the emergency room. Lastly, there's a value-based benefits program and separate prescription out-of-pocket maximum for the PPO plan. Now let's compare the cost of each plan. For faculty and staff, payroll contributions for medical insurance are based on your annual base salary as of October 31st, 2018. The percent of salary did not change from 2018. As you complete open enrollment in Workday, you will see your specific rate. For technical service employees, the percent of salary is based on the provisions of the collective bargaining agreement. Contributions will be based on your salary as of September 30th, 2018. Again, as you complete open enrollment in Workday, you will see your specific rate. So let's first take a closer look at the PPO savings plan. In the PPO savings plan, all of your expenses count towards your deductible. This includes office visits, labs, surgery, radiology, prescriptions, inpatient and outpatient visits. Once you reach the deductible, you begin to pay 10% coinsurance for most in-network services until you reach the out-of-pocket maximum. If you reach the deductible and coinsurance out-of-pocket maximum, the plan begins to pay at 100%. If you are new to the PPO savings plan, a health savings account is automatically opened on your behalf, which we'll discuss later. In the PPO savings plan, the annual deductible, or the amount you have to pay out of pocket before the plan begins to pay, is $1,600 for individuals and $3,200 for family coverage. Once the deductible is met, the plan begins to pay at 90%. You are responsible for 10% coinsurance for in-network services until you have paid an additional $1,975 for individual coverage or $3,950 for family coverage. All preventive services are covered at 100%. Other services listed will be charged to you at the Aetna contracted rate and will apply towards your deductible and coinsurance. The one exception is Teladoc, which has a maximum fee of $40. The $40 is applied towards your deductible and coinsurance. For prescriptions, you will pay the full CVS Caremark or University Health Services contracted rate until you reach your deductible. Once you reach the deductible, if you use generic medications, you will pay the lowest coinsurance of 10%. Formulary brand and non-formulary brand prescriptions have a coinsurance of 20% and 40% respectively. Specialty medications have a 20% coinsurance and a $65 minimum for preferred medications, while non-preferred medications have a 40% coinsurance and $100 minimum. For a list of preferred medications, visit caremark.com. As stated previously, if you enroll in the PPO savings plan, a health savings account, or HSA, will be opened automatically on your behalf through Health Equity. The HSA is a bank account that is yours to use to pay for qualified medical expenses. The funds you put into the HSA go in tax-free, grow tax-free, and come out tax-free, provided they are used to pay for qualified medical expenses. Once the funds are in your account, they are yours and go with you if you retire or leave Penn State. The Health Equity portal enables you to pay the providers or pay yourself directly from the website. Some important things to note about health savings accounts are First, the funds must be in the account before you can spend it. Also, if you have other insurance or Medicare, you are not permitted to participate in an HSA. You also cannot have a balance in a healthcare FSA from another employer. If you join the PPO Savings Plan for 2019 and have a Penn State 2018 flexible spending account, funds will be forfeited as of December 31st of 2018. Lastly, there's a $1.75 fee that will be deducted from your account each month. For the health savings accounts, the university is providing seed money based on your annual base salary. If you enrolled in the PPO Savings Plan for 2018 and re-elect for 2019, you must log into Workday and elect the health savings account in order to receive the Penn State contribution in January. You may elect to contribute additional money to your HSA through payroll deductions up to a combined Penn State and employee maximum of $3,500 for an individual or $7,000 for a family. For those 55 and older, you may contribute an additional $1,000. Unlike a flexible spending account, you can change, start, or stop contributions throughout the year. As mentioned before, funds must be in the account before you can use them. Penn State's seed money will be available to use at the beginning of the year. Now, let's talk about the other health plan option, the PPO plan. The PPO plan has a higher payroll contribution, but the deductible amounts are lower and are based on your annual salary. The PPO plan deductible is structured differently from the PPO savings plan in that the deductible is, quote, embedded. This means that any one family member can reach the individual deductible, and then that person moves into the coinsurance portion of the plan. In the case of family coverage for an employee with a base salary of $45,000 to $60,000, the deductible is $375 for one person, then the deductible for the remainder of the covered individuals is also $375. After the total deductible of $750 is met, then all of the covered individuals on the plan are covered at 90% with a 10% coinsurance until you reach the coinsurance out-of-pocket maximum. For technical service employees, deductible amounts are $250 for individuals and $500 for family coverage. Again, the deductible is, quote, embedded. The copays for technical service employees follow the terms of the collective bargaining agreement. In the PPO plan, there is a separate out-of-pocket maximum for prescription costs depending on your employment classification. For faculty and staff, the out-of-pocket maximum is $2,000 for individuals and $8,000 for family coverage. For technical service employees, the out-of-pocket maximum is $1,000 for individuals and $6,000 for families. For a 31-day supply of generic or preferred brand medications, you will pay 50% coinsurance. For a 90-day supply of generic or preferred brand medications, you will pay 20% coinsurance. Choosing a 90-day supply reduces your out-of-pocket costs. An additional benefit to the PPO plan is the Value-Based Benefits Program. This structured program assists members with any or all of the following diagnoses: diabetes, high blood pressure, and/or high cholesterol. Fees are waived for office visits, required lab work, and certain diabetic supplies. Therefore, no deductible or cost sharing applies. This offers some assistance to individuals with high expenses due to these conditions. Contact Aetna to enroll. The benefit begins once you're enrolled and is not retroactive. However, once enrolled, you do not have to re-enroll each year. The next benefit we will discuss are the flexible spending accounts, or FSA, options. Penn State will continue to offer both the healthcare flexible spending account and the dependent care account. FSAs allow you to set aside funds for yourself and for your dependents on eligible medical expenses and dependent care expenses. The healthcare FSA maximum is $2,700 per calendar year, and the dependent care FSA maximum is $5,000 per household per calendar year. Contributions to the FSA are tax-free, and the primary difference between the HSA and the FSA is that you must use the funds in the account by the end of the planned year, or you will forfeit the funds. You are also not able to make any changes to this election unless you experience a qualifying life status event such as marriage, divorce, or birth of a child. Eligible expenses for the FSA are the same as the HSA. Claims must be incurred during the planned year. However, there is a carryover provision on the healthcare FSA, which allows you to carry over up to $500 into 2019 if you've not exhausted all of your FSA funds by December 31st, 2018, and you re-enroll in the healthcare flexible spending account for 2019. Please remember, only those employees who enroll in the PPO plan or are enrolled in a traditional plan through their spouse are eligible to participate in the healthcare FSA. Next, we'll discuss information related to spousal coverage. For faculty and staff, if both spouses work at the university and enroll in two-person or family coverage, the higher paid employee must elect the coverage, while the lower paid employee must waive coverage. It is important to note you do have the option to move into separate plans if you wish. For technical service employees, this applies only if both spouses are technical service employees. It does not apply if the spouse is faculty or staff. It is important to note you do have the option as well to move into separate plans if you wish. The spousal surcharge only applies to faculty and staff. If you cover a spouse who is eligible for group health insurance elsewhere, an additional $100 per month will be assessed. This does not apply to technical service employees. As part of either health insurance plan, Penn State has an agreement with Quest Diagnostics and LabCorp to offer lower costs for non-urgent lab work. If you choose to use a Quest or LabCorp facility for your lab services, you will pay the least amount of coinsurance of 10% after your deductible. Also, if you receive lab services as part of an emergency room or inpatient hospital visit, you will only pay 10% coinsurance. If you use any other in-network lab, you will pay 30% coinsurance after your deductible or 50% coinsurance after your deductible if you use an out-of-network lab. There are many Quest and LabCorp locations throughout the Commonwealth for easy access. Next, we're excited to announce our new vision insurance provider, iMed. While the benefit design remains the same, there are several new enhancements with iMed. The allowance for frames and contacts is increasing to $130 every other year. In addition, if you use Target or Sears Optical, you can get any frame regardless of the cost. You also get a 40% discount on any additional pairs of glasses. With iMed, we have an expanded network of providers including LensCrafters, Pearl Vision, Glasses.com, and Target Optical, in addition to other independent providers. Additionally, iMed offers a 40% discount on hearing exams and a set pricing on hearing aids, in which members saved an average of 55% last year. Next, we'll talk about the dental insurance. For 2019, the dental provider will still be United Concordia. There are no benefit changes to the plan, however, payroll contributions have decreased for 2019. Routine services such as cleanings, x-rays, and exams are covered at 100% when you use an in-network provider. Class 2 and Class 3 major services are covered at 80% and 60% respectively after deductible. Penn State also provides short-term and long-term disability insurance. Short-term disability insurance can help you with income replacement if you are off of work for an extended period of time because of non-work-related illness or injuries. Before the benefit begins, you must exhaust all of your sick time. You have the option to choose a 14-day or 30-day elimination period. The benefit provides you with 60% of your weekly earnings up to a maximum benefit of $1,500 per week, offset by any vacation time being used at the same time. There is a pre-existing condition clause that applies to the 3 months prior and 12 months after the effective date of coverage. You have a pre-existing condition if you have received medical treatment, consultation, care, or services, including diagnostic measures, or took prescribed medicines in the 3 months prior to your effective dates of coverage, and the disability begins in the first 12 months after your effective date of coverage. Long-term disability, or LTD, provides you and your family with protection from loss of income if you become unable to work because of an accident, illness, or injury. The cost and benefit remains the same for 2019 as in 2018. As part of LTD insurance, you have the option to elect retirement income protection, which will continue to contribute to your retirement in the event of your disability. You may join at any time with evidence of insurability. Another benefit provided by Unum is life insurance. For 2019, employer-paid life insurance will remain at $50,000 for faculty and staff and $20,000 for technical service employees. If you want to purchase additional life insurance, you may do so during benefits open enrollment. You may increase 1 times your salary without proof of good health up to a maximum of $1.5 million or 8 times your salary. This year, there will be a second coverage option for dependent children up to age 26. You can either choose $5,000 or a $10,000 option. Proof of good health is not required. Lastly, you have the option of electing accidental death and dismemberment insurance. Employees may elect AD&D insurance, which provides protection against financial losses due to accidental death or accidental dismemberment. Benefits remain the same for 2019. Contributions will also remain the same, and you are able to join during open enrollment without proof of good health. If you're adding a new dependent, it's important that you complete the dependent verification process. The purpose of dependent verification is to confirm benefit eligibility of any new dependents you've enrolled in the medical, vision, or tuition discount program. Any new spouse or dependent child must be added and verified for eligibility through Workday by uploading the required documents. Next, we'll talk about the supplemental retirement options. Regardless of if you participate in the SERS or TIA retirement plan, you have the option to participate in a TIA supplemental retirement option. Options include a 403B tax-deferred annuity and or a 457B deferred compensation plan. There are some subtle differences between the two. If you're interested or want to enroll, simply complete an enrollment form in Workday. Unlike other benefits, you may elect and change contributions to supplemental retirement at any time. So what are your next steps? Starting November 1st through November 16th, you'll log into Workday and find your open enrollment event in your inbox to either elect or waive benefits coverage. Be sure to use Firefox or Chrome browsers, as Workday does not display correctly in Microsoft Edge, Internet Explorer, or Safari. If you do not take any action, you'll default into your current elections. For items such as the healthcare savings account and flexible spending accounts, your coverage will end if you take no action. If your open enrollment event is on hold, that means there's another change of benefits event in Workday that must be completed before you can proceed with the open enrollment process. As you're completing open enrollment in Workday, there are some terms you'll see. Elect is the term used when choosing to enroll in a benefit for 2019. Waive is the term used for declining a benefit for 2019. The other terms you see are related to navigating through the open enrollment process. You'll have the option to save your progress if you need to complete open enrollment at a later time. You'll need to make sure you return to Workday and submit your open enrollment event by Friday, November 16th, no later than 5 p.m. Eastern. After that, the event will close and you'll default into your current benefits. Current 2018 PPO savings members who are remaining in the plan for 2019 must elect the Health Savings Account in order to receive the Penn State seed contribution in January. Workday will alert you with an error if you do not elect the HSA before you can submit your elections. You may enroll or update your beneficiary designations during open enrollment, or you can skip this step now and enroll or update at any time during the year. To enroll dependents, click on the Enroll Dependents bar. Click on the drop-down menu symbol and follow the instructions. If you're enrolling in a medical plan, you must elect and waive the spousal surcharge accordingly. Workday will alert you with an error if both elections are set to waive. In order to finalize your elections, click I agree and then hit Submit. If you need to make changes after you've submitted, click on the Benefits Worklet from the Workday home screen. From there, click Change Open Enrollment to reopen your open enrollment event, and remember to hit Submit to finalize your changes. Thank you for taking the time to watch this benefits presentation. For more information, visit Workline or the HR website at hr.psu.edu. If you have questions about specific benefits, contact the appropriate benefit administrator listed.